So we're going to be talking a little bit about C-section recovery with Beth today. So Beth, after have you got any tips for after you've had a C-section?
Yeah, absolutely. There's a number of things that I would say are sort of key for anyone experiencing this. One of the first things to think about is trying to get moving as quickly as you can, but part of that is making sure that your pain relief is kind of optimal, really, because it can be really quite uncomfortable. You've just had major abdominal surgery, and I think sometimes we don't think about that so much with the C-section, but we know that our whole body, our bladder, our bowel, we're better able to start recovering if we get moving, really. We're less likely to get some complications, but in order to do that you need to make sure you've got plenty of pain relief. So chatting with your midwife if that's not going well for you.
So have you got any advice on kind of abdominal support when you're doing various activities that increase your intra-abdominal pressure?
Yeah, so I think sometimes we underestimate how uncomfortable it can be. You have got quite a big scar, so in those early days, providing support, say with a pillow or a towel, if you can anticipate you're going to, for instance, get out of bed or sit up, or particularly cough or sneeze, because that can be really uncomfortable, so that can be helpful. In general, wearing fairly loose clothing, I think in those early days, you might want to utilise the kind of your maternity trousers, still even your underwear that goes up quite high to kind of comfortably cover the wound that will obviously initially be dressed, and make sure things aren't then sort of digging in, and you want to obviously be keeping an eye out for things like infection, so any kind of weeping, any obviously smelling of the wound, anything like redness, irritation, or obviously if you're starting to feel unwell in yourself, then obviously always seek guidance via your GP or midwife if that's the case. But yeah, just sort of almost planning a little bit about what you might wear.
And how about constipation?
So initially, with those effects of the anaesthetic, if you had an anaesthetic or even the epidural, and just then being having had labour, or maybe not had labour, but then being immobile for a period of time, and then taking pain relief, that can really have a knock-on effect on your bowel function, even if your bowels are normally absolutely fine. So yeah, you want to be really making sure that you avoid getting constipated, for the sake of your pelvic floor, and also straining from your tummy as well. So trying to make sure you keep yourself well hydrated. Early moving around, as we said, can be really helpful for that as well, but trying to also prioritise some fresh food, particularly things high in fibre, which can be difficult when you've got a very newborn baby and you're not getting much sleep, we all know.
Perfect. And so yes, it's important to pace and accept help from friends and relatives, just sort of listen to your body, not try and push it in those sort of early weeks.
Yeah, just do things very gradually. Walking, starting off with some gentle walking and then building that back up. In those first or second week, around 2 weeks to 6 weeks in, things might look like they're healed from the outside, or getting that way, but obviously everything's still knitting together inside. Your body's very much still in recovery mode, so it's doing things in a very graded way and being really careful around lifting. Obviously you have a newborn baby, so inevitably there are things in an ideal world that you might not do that you will, but just trying to limit those things, and being careful with how you're doing, and seeking help where possible, so that you can avoid irritating things too much. And it's also potentially going to be helpful to keep an eye on what your bladder's doing as well. Sometimes that can be affected initially from the pain and the effects of the C-section. You might find our video on bladder habits a helpful thing to also watch through. There's also a misnomer that our pelvic floor is sort of spared by having a C-section rather than a vaginal delivery. That's not really the case up to a point, because it's pregnancy itself that puts quite a lot of load on the pelvic floor and stretches it quite significantly. And also for some women who've had a potentially an emergency cesarean, they may have already partially been through labour, even up to a point of the pushing stage. So it could be that both your pelvic floor is affected by that as well as just the pregnancy itself. So it's really important to think about starting to do some pelvic floor exercises or getting back into that if you were doing that antenatally as well. It doesn't mean you can just forget about that because you've had a cesarean.
Thanks, Beth. And talk to me about scar tissue massage. When would you maybe start that? Why would it be helpful?
Yeah, so our C-section involves cutting through 7 layers of tissue, so it's quite extensive. We will naturally obviously develop a scar, and it can be really helpful to keep an eye on what your scar is doing. There will be a degree of loss of sensation around there as well, which can take some long time to come back and may never fully recover, but there's lots you can do to keep your scar happy, and basically we probably wouldn't suggest you start that for the first 6 weeks, but after that time, if everything's healed well, then you can start to do some techniques to make sure that that scar is moving nicely, and you can encourage it to move a bit more, which can be helpful for lots of things, your bladder function, pain, etc., and just getting back to normal. And so we'll go through some of those techniques for you now.
Small circles around your scar. Starting above your scar, apply a light pressure with 2 to 3 fingertips and move your fingertips in small circles. Move your fingers slowly along the length of the scar, touching the tissue just above and below the scar. As you feel more comfortable, you can slowly start to put pressure on the outer edges of your scar and ultimately perform the circles directly over the scar tissue. Up and down. Starting with 2 fingertips, move your fingertips gently up and down over the scar, moving from left to right or right to left, and back. Again, gently applying more pressure as tolerated. Side to side over your scar. Again, using your 2 fingertips and just moving gently from side to side, mobilising that scar tissue. From side to side gently, backwards and forwards over the scar tissue.